Well, when a president is yelled at by a member of Congress, when thousands of people march to protest his ideas, it is easy to lose sight of the common ground. So this morning we take a look at the one thing everybody wants out of reform. But is it enough to heal America's system, ranked 37th in the world in health care?
Under this plan, it will be against the law for insurance companies to deny you coverage because of a pre-existing condition.
Well, will you look at that? A standing O from both sides of the aisle and the most powerful lobbyist in the health insurance business.
We are strongly for eliminating pre-existing conditions so no American ever again has to worry about being locked out of the healthcare system.
Whoa, wait a minute.
Denied?
Isn't this the industry that makes more profit by denying coverage?
You authorized payment on the Walker policy?
An industry mocked for its cold heart in movies like The Incredibles?
I don't want to know about their coverage, Bob. Don't tell me about their coverage. Tell me how you're keeping Insuracare in the black. Tell me how that's possible with you writing checks to every Harry Hardluck and Sally sob story that gives you a phone call.
Auto insurance companies don't want to cover drunk drivers, and home insurers don't want to cover burning houses. So why would a health insurance company suddenly want to cover someone like Megan Edelstein?
I'm not a good investment.
After being diagnosed with stage 3 cervical cancer at the age of 28, this law student needed chemo, radiation, and 12 surgeries. And in the middle of it all, her insurance company cut her off.
They said that I had cancer for a long time and that I was aware that I had cancer.
So why the change of heart now? Well, politically, the industry sees that ovation and knows that this change is tough to fight. And as long as the government forces everyone to buy coverage, it will be good for business. Here's how. Let's say I start an insurance company. I'll call it WeirCare. And I'll take on one customer named Kate and charge her, say, $5,000 a year to assume the risk that she might get run over by a horse and carriage in Central Park. If she does, heaven forbid, and runs up a $100,000 hospital bill, WeirCare goes broke. But if I have 1 million customers, I can take $1 from each and pay for Kate. This is called spreading the risk, and the industry is happy to take on sick customers like Megan, as long as the government gives them millions of healthy customers as well.
What we do by having everybody participate, you spread the cross across the entire pool of individuals.
But doesn't that mean that everyone's premiums will go up? Good question. You see, one reason that healthcare is so expensive now is that the uninsured are forced to make expensive trips to the emergency room.
Those patients oftentimes don't have the money to pay the physician for services. Now they'd be able to visit a local physician that would provide them ongoing health care coverage.
This could lower costs, along with the insurance industry's new motivation to help Americans lead healthier lives.
You have a food movement building in this country to get us off of heavily processed food and get us to eat fresh food, home-cooked. All this movement needs now is a powerful ally, like the health insurance industry, to really put it over the top and bring big changes in the way America grows food and the way America eats.
But aside from hoping that Blue Cross will lean on Burger King, much more needs to be done to bring healthcare costs down. So who do you trust to do it? Insurance companies that have raised premiums 3 times faster than wages?
Now we have to have the rest of the healthcare system working together to try to find those efficiencies.
Or a government that has failed at healthcare reform for decades?
An additional step we can take to keep insurance companies honest is by making a not-for-profit public option available in the insurance exchange.
While the debate rages, people like Megan wait and hope.
I try to make it with as positive as an attitude as I can because I don't have any other choice. I cannot pay those bills.
Whatever happens, she has a long wait ahead of her. Most of the bills on the Hill right now would not provide health insurance for everyone until 2013.